Governor Janet Mills announced today that Maine is significantly expanding contact tracing by increasing the number of skilled staff and volunteers, harnessing innovative technology, and securing social services to help people with COVID-19 maintain self-isolation. Contact tracing is the process of identifying, assessing, and protecting people who have been exposed to disease. This prevents transmission of infection to others. Taken together, testing and contact tracing enable Maine to identify, investigate, and isolate individuals with COVID-19 to prevent its spread in the absence of effective treatment or vaccines. Maine's contact tracing system has three parts. The first is increasing personnel. The Maine CDC currently has a contact tracing and case investigation team of approximately 30 people. It expects to more than quadruple this team as needed through the following steps. First, immediately we are enlisting the help of 50 trained volunteers who have offered their skills through Maine Responds, a system to tap into healthcare, public health, and emergency volunteers to respond to emergency situations. These volunteers will assist us for at least 2 months and will start their training on June 1. Second, we're going to begin hiring up to 125 contracted staff over time for up to 12 months to supplement Maine CDC's work. This hiring will be staggered in stages based on COVID-19 trends and data and will prioritize proficiency in multiple languages to help address the disproportionately high rates of COVID-19 among racial and ethnic minorities. And third, we're deploying SARA Alert System. The SARA Alert System has been developed to help track contacts. Specifically, it will help report daily symptoms through a web, text, emails, or calls. The tool provides real-time insight and increased capacity to support these individuals and contain the virus. It also enables hospitals and health systems to conduct contact tracing for their own employees. It does so in a way that's privacy protected and links to social services and supports, which is a third part of our strategy. Maine will be expanding its social supports to ensure that people who are in self-quarantine or self-isolation can stay alone when they are struggling with low income or housing needs or mental or substance use disorders. To address these challenges, DHHS is expanding its services through contracts through Community Action Programs, or CAPS. Once finalized, these arrangements will offer individuals in isolation or quarantine supports such as delivered meals, prescriptions, and behavioral health counseling. The CAPS will subcontract with minority-run, community-based organizations to provide culturally appropriate services. We will also contract with Wabanaki Public Health for support for Native Americans and Catholic Charities, which operates the state's refugee program, to help with language translation, interpretation, and act as cultural brokers for new Mainers and other populations. Maine will also hire a point person to coordinate this work in recognition that social services are often as important as medical and public health services for people with COVID-19. The expansion of contact tracing parallels the Mills administration expansion of COVID-19 testing for the state of Maine. As we ramp up testing, we will need more people to do contact tracing. Last week, as Dr. Shaw noted, we tested as much as 1,000 tests per day, and we continue to build our capacity. So as we build that capacity to make sure that all people in Maine can have access to testing for COVID-19, we will similarly stage our expansion and supports for them through contact tracing.